Okay, so we're going to be addressing those of you who are searching paresthesia treatments. I'm Dr. Martin Rutherford. I am a certified functional medicine practitioner, a chiropractor, also for 36 years. This is Dr. Randall Gates.
I'm a chiropractor and a board-certified chiropractic neurologist.
And board-certified chiropractic neurologists work with function of the brain and the nervous system, and utilize a variety of methods to address things like paresthesias. And we have melded our two disciplines together in an effort to address chronic pain. And we have developed a chronic pain practice that treats a wide variety of chronic pain conditions and symptoms without, for the large part, without drugs. It's an integrated practice. And so we thought we would address those people who are questioning or out there searching about paresthesias. They have a very specific meaning, and they require, what we have observed, require a specific approach. And I think I would have to say we've had pretty consistently successful results with people who come in with peripheral neuropathy and have paresthesias, or people who come in with back problems or neck problems and have paresthesias. So we'll share that with you over the next couple of minutes and hope that it will answer some of your questions. So paresthesias.
Yeah, tingling and numbness, and many of you have had that experience so analogous to your foot falling asleep. Unfortunately, if you have paresthesias, you probably know that it's happening most of the time, and can be very uncomfortable. I would say that we've had success because we're pretty good in identifying the cases that we can take on versus the ones we can't. Some of you have paresthesias out there, and we work hand in hand with the top neurosurgical facility in our area where it looks like it's out of our control, then we just refer them there for whether they need epidurals, whether they need an actual surgery. But for those milder cases which may respond to conservative care, let's say it's a neck issue, then we put the person through therapies to basically help their disc herniation improve. We do traction, we do a lot of nerve stimulation exercises. We have some pretty sophisticated equipment that helps to basically reprogram the nerve back into life and transmitting the proper signals. We do the same thing for the lower back. Dr. Rutherford, before I got here, was long involved with a type of decompression unit that he was very selective in putting patients on. You know, some doctors out there just put everybody on their decompression table.
Right.
You were very selective in finding the right patient who could respond to that type of therapy while doing nerve stimulation. Therefore, their tingling and numbness in their feet or their legs lots of times would go away, and I've seen that to be true over our 5-year relationship. And then the infamous peripheral neuropathy, which is really our passion now, amongst many other things, which involves where the nerves start to degenerate or die, most commonly down the feet. It can progress up to the knees and then hit the hands in a common pattern. And it's usually due to quote-unquote metabolic conditions. Metabolic meaning things like diabetes, autoimmune problems, vitamin deficiencies, food intolerances, believe it or not, cancer, things of that nature that can cause those nerves to degenerate or die. And we have worked to meld our two disciplines such that Dr. Rutherford and his functional medicine training and my functional neurology training as a board-certified chiropractic neurologist, we have worked to create programs where we address the underlying metabolic cause. Let's say it's something as simple as a vitamin deficiency, with stimulating the nerves back into life, and have had some pretty interesting success stories with that. Again, with the properly selected patients. We have found some patients don't respond to what we do, but we have a way of screening that has seemed to increase our success rate. And it also needs to be elaborated on, we've talked about in other videos, but singularity in treatments of peripheral neuropathy in our experience don't work as well, and the literature supports this. So you can go and you can give somebody a B vitamin if they're deficient in B vitamins, and lots of times that doesn't help their paresthesias, their numbness and tingling in their feet.
Like 96% of the time or more.
Vice versa, you can go in and do nerve rehab for that person with paresthesias, and they may get some temporary relief, but it's not long-lasting. Hence, those two interventions are not commonly employed in the medical field because they say, well, that doesn't work and that doesn't work. However, by bringing these two together, by addressing the B vitamin deficiency, let's say, and by rehabbing the nerves, we have worked to create programs that, in our experience, are producing some pretty cool success stories for paresthesias due to peripheral neuropathy.
So overall, paresthesia, there's a gradient. I think that the thing to understand is a lot of people come in here, and I do the consults here to do kind of patient evaluations as to who might be a good candidate. I think one of the things that people kind of light up on or cognite on is there's a gradient, and you get and these paresthesias develop over a period of time, most of the time, unless you just got a disc problem and it suddenly came out of nowhere. But I think the takeaway is if you have paresthesias, it pays to get a thorough evaluation and find out where you are on that gradient, and probably pays to, unless it's extremely obvious that you get an MRI and you have a herniated disc. Usually, I think it pays to start with some sort of a conservative treatment first. Try to get a full evaluation so that you get a specific evaluation, you get a specific opinion from the doctor that this is what's probably causing your paresthesia. That puts you into a certain category, and then relative to that category, there's a gradient. Usually it's best, unless it's obvious, to try conservative treatment first. For those people with whom it's coming from maybe a back injury, if conservative treatment doesn't work, the next step might be an epidural or decompression. I don't actually put decompression into a conservative treatment because insurances don't cover it, and it can get a little costly. But conservative treatment might be any of the things that Dr. Gates talked about, the stimulations, diet, these types of things, electrical stimulations, manipulation from a chiropractic point. And then you probably end up moving into more or less maybe decompression if you have a low back problem, or you start ending up into epidurals if you have a low back problem. And then ultimately, even an occasion surgery is going to be the answer. But paresthesias are the success of the treatment usually is based on the proper evaluation of the patient and putting the proper method to the proper evaluation. And I think that's where we fall short on these. In most cases, you got numbness tingling here, take this, here, do that. We'll try this, we'll shotgun that. So it's a little challenge. Paresthesias are always kind of a little bit like, ooh, okay, we got some numbness and tingling here. That could be a lot of things. I want to emphasize you need to find somebody who you feel confident can do a good evaluation on you, and then things tend to flow better from there. That would be what I would add to that. So, all right, so that's paresthesias in our world. Hopefully that's somewhat helpful. If you have any questions, any specific questions relative to maybe you having paresthesias or someone having paresthesias, and we didn't cover that, feel free to contact us, or contact us by email or contact us on powerhealthtalk.com. Dr. Gates will usually answer those correspondences. We are also on Facebook, and I guess that would be it.
And then we have the peripheral neuropathy group.com coming up. So our producer is uploading our videos to www.peripheralneuropathygroup.com. As we mentioned, peripheral neuropathy can cause paresthesias, and so we have a lot of data on there, a lot of information for you to view. Hopefully that will be helpful in answering some of your questions.
Okay. Thank you for watching.